Hello everyone, a very warm welcome and thank you for logging onto the Smart RN channel. My name is Henry. Today we are going to look at chronic kidney disease or CKD in short. Chronic kidney disease is at times referred to as chronic kidney failure, and this refers to the progressive and irreversible loss of kidney function. Just as a reminder, when we looked at acute kidney injury, we said that acute kidney injury is rapid and occurs abruptly over a very short period of time. At the same time, acute kidney injury is reversible. We can be able to restore the kidneys back to their normal function if we address the causes of acute kidney injury on a timely basis. But with CKD, it is progressive, meaning it occurs in stages, then it is irreversible. We cannot be able to recover that part of kidney function which has already been lost. Once the function is lost, that is it. We cannot be able to do anything about it. And then number three, CKD occurs over a long period of time. So when you compare acute kidney injury to chronic kidney disease, acute kidney injury is abrupt, it is rapid, it is reversible, and it occurs over a short period of time. With CKD, it is progressive, occurring in stages, it is irreversible, we cannot be able to recover the lost kidney function, and then it occurs over a long period of time. So what are the risk factors for chronic kidney disease? There are a number of factors that expose people to chronic kidney disease. Factor number one, we have long-term disease conditions. Those long-term disease conditions like hypertension, diabetes, lupus, polycystic kidney disease, heart failure, all these are conditions that can cause chronic kidney disease to develop in a person. Then we also have smoking. Smoking is that practice which is responsible for a number of diseases in our body system. And one of these diseases is chronic kidney disease. We have hyperlipidemia. These are elevated fat levels in our bloodstream. When we have got elevated fat levels in our bloodstream, they cause what we call plaques to develop in these blood vessels. And then these plaques normally obstruct the flow of blood in the blood vessels. So if we have blood vessels supplying blood to the kidneys being blocked by the plaques, then the kidneys are going to be affected and we are going to have chronic kidney disease. We have obesity, overweight, or elevated weight levels. This can cause CKD in individuals. We have recreational drug use. The use of drugs like cocaine, the use of drugs like heroin. These drugs have very negative effects on our body systems, including the kidneys. Then we have glomerulonephritis. Just as a reminder, the glomerulus is that part of the nephron which is concerned with the actual filtration of blood into urine. It is made up of a network of blood vessels. These blood vessels are semi-permeable. So if this glomerulus is infected, we say it is glomerulonephritis. So if the glomerulus is infected, it has the possibility of causing CKD in individuals. Then we have acute kidney injury, which is poorly managed. Now, we say that acute kidney injury is reversible. But if it is not managed well, it has the possibility of progressing to chronic kidney disease. So those patients who have had acute kidney injury have a higher risk of developing chronic kidney disease, and especially if that acute kidney injury is not managed very well. So we have just said that CKD occurs in stages. It is progressive. And these stages of CKD can be differentiated when we look at the glomerular filtration rate. Or in other words, we can differentiate the stages of CKD using the glomerular filtration rate. The glomerular filtration rate is simply the rate at which the glomerulus filters blood to form urine. The normal filtration rate is equal to or more than 90 milliliters per minute. So when the glomerulus is filtering blood at the rate of 90 milliliters or more per minute, then that's a normal glomerular filtration rate. That is what we expect in normal functioning kidneys. So let us look at the stages of CKD based on this glomerular filtration rate. Now, we have got 5 stages of CKD. We have got stage 1, stage 2, stage 3, stage 4, and stage 5. Now, stage 1 is that stage of CKD in which the glomerular filtration rate is equal to or more than 90 milliliters per minute. This is a unique stage of CKD because the glomerular filtration rate is normal. The kidneys are functioning normally. Remember, we said that if we have a glomerular filtration rate of 90 ml or more per minute, that is normal filtration. So this is a unique stage that has a normal filtration rate. So what makes it CKD? It is CKD because of the minimal renal damage which has occurred to the structure of the renal system. In this stage, we have got structural changes which indicate renal damage, and this renal damage is very minimal. Remember, in CKD, we cannot be able to restore or to reverse that part of the kidneys which has already been lost or destroyed. So in this stage here, even though we have a normal glomerular filtration rate, there is damage that has occurred to the structure of the kidneys, and that damage cannot be undone. So that's why this is CKD stage 1 with a normal glomerular filtration rate, but with minimal renal damage that will never be recovered. So stage 1 of chronic kidney disease is where the glomerular filtration rate is equal to or more than 90 milliliters per minute, and it has got a minimal renal damage to the structure of the renal system. CKD stage 2 is whereby we have got mild renal damage, and the glomerular filtration rate in this stage is 60 to 89 ml per minute. Now, in this stage of CKD, the glomerular filtration rate has gone down. Now, the lost filtration rate will never be recovered. This is the maximum right now, 60 to 89 ml per minute. So this is stage 2 of CKD. In chronic kidney disease stage 3, there is moderate to poor renal function. There is now a great damage that has occurred in the renal system, reducing the glomerular filtration rate to 30 to 59 milliliters per minute. The kidneys are now operating at half their capability, 30 to 59 ml per minute. So we have now substantial renal damage which has caused this glomerular filtration rate to go down. In CKD stage 4, the glomerular filtration rate is between 59 to 29 milliliters per minute, and this is because of the severe renal damage which has occurred to this particular system. The maximum filtration rate that the kidneys can now achieve is only 29 milliliters per minute, far below the functional level of the kidney. So stage 4 CKD is where there is severe renal damage, reducing that glomerular filtration rate to between 15 milliliters to 29 milliliters per minute. In stage 5 of CKD, the glomerular filtration rate is less than or equal to 15 milliliters per minute. And in this stage, chronic kidney disease is referred to as end-stage renal disease or ESRD. The glomerular filtration rate is greatly compromised. Now, in this stage, we have either little or no urine at all. These patients are making only very little or no urine at all. So it is little because it is less than 15 milliliters per minute, or no because this less than 15 milliliters per minute can also be zero. There's no filtration at all. So that is end-stage renal disease. So you'll find these patients are not making any urine at all, or they are making very, very little urine. So what are the clinical manifestations of chronic kidney disease? Just to remind you, when we started looking at the renal system, we said that any damage to the renal system will also be reflected in the other systems of the body. The other systems of our body are going to be affected as a result of the effects of any damage in the renal system. In other words, these systems depend on the renal system. So when you have problems with the renal system, then these systems are also going to develop issues. So as a result of that, the clinical manifestations of CKD can also be expressed by looking at the effects on other systems. So number one, we have got the clinical manifestations in the cardiac system. So we have got heart failure because of the volume overload. The heart cannot handle this fluid. So we have heart failure. We have got hypertension. So, again, because of volume overload, our blood pressures are going to be elevated in this patient. Then we have got cardiac arrest. These patients have got electrolyte imbalances, and especially potassium, which may be elevated to higher levels, causing problems like cardiac arrest in this particular patient. Then neurologically, these patients are fatigued. You find they have got headaches, they have got seizures, and they can also enter into a coma because of the accumulation of waste products in the bloodstream. On the respiratory system, the patients are going to have pulmonary edema. Remember, there is fluid collection in the various parts of the body. So when fluid collects in the lungs, there is going to be compromised air exchange, and this will result in shortness of breath. So when these patients have got fluid overload, one of the major things they normally complain about is shortness of breath because of the accumulation of fluid in the lung system. Hematologically, they have got chronic anemia. Now remember, we said that when the kidneys are infected, they not produce erythropoietin, and it's this erythropoietin that stimulates the production of red blood cells in the bone marrow. So without erythropoietin, these patients have chronic anemia, reduced blood cells all the time, or reduced blood volumes in their system. Now, on the GI system, the gastrointestinal system, these patients have got nausea, they are vomiting, they also have anorexia. Why? Because of reduced appetite, decreased appetite. They do not have that appetite of having food. So we have anorexia in this patient. On the skeletal system, we are going to have abnormal bone changes and even abnormal bone growth. Our bones depend on calcium. And at this particular time, because of CKD, the calcium is not being absorbed in the GI tract as a result of the inactivation of vitamin D. Remember, we said that for calcium absorption, we require vitamin D, and this vitamin D is normally in an inactive form. So it is normally activated in our kidneys. So because the kidneys are now, we have got chronic kidney disease, then we do not have adequate calcium absorption in the GI tract. So we are going to have abnormal bone changes and even abnormal growth in this particular patient. And then we have got electrolyte and fluid imbalances. Now, fluid imbalances because of volume overload. The kidneys play a very important role in the excretion of excess fluid from our bodies. So these patients have got swollen ankles, they have got swollen legs, they have got swollen faces, we have got abdomens that have got a collection of fluid. So this is because the kidneys cannot be able to clear fluid from their body. So that's fluid imbalances. And then electrolyte imbalances because we have got imbalances in electrolytes, various electrolytes in the body. For example, potassium. Potassium levels are going to be elevated. Why? Because the kidneys are the ones that play a role in the excretion of potassium from our bodies. We are going to have decreased levels of calcium because of the inadequate absorption of calcium in the GI tract. We are going to have elevated levels of phosphate. Remember, phosphates are normally in an inverse relation with the calcium. If calcium goes down, the phosphate goes up. So we are going to have phosphate imbalances or elevated levels of phosphate in our bloodstream. So we are going to see electrolyte and fluid imbalances in these particular patients as a result of this chronic kidney disease. So this brings us to the end of this video on chronic kidney disease. Be sure to watch the next video on the management and diagnosis and even the nursing intervention for chronic kidney disease. As always, drop a comment, like this video, share this video, and if you are not a subscriber to the Smart RN channel, I request you to subscribe today. Thank you.